Welcome to Get Moving TV. I'm Dr. Chris Landon, I serve as your host. Here in Ventura County, we have, again, an extraordinary set of technological resources. We have extraordinary hearts that are supporting our families, and we are extraordinarily fortunate in the amount of education in our physicians that's available to all the citizens of Ventura County. People who I help take care of are benefited by this, but also the students. We have nursing students. We have people who want to go into the practice of medicine. We have Foothill Technology High School. These are some of the brightest kids I've seen, and over the summers we do research with them. But with me today is someone who's a true jewel at Ventura County Medical Center, Dr. Herman. Welcome to Get Moving TV.
Thank you.
Well, the other day, I saw you in our auditorium, and you had some extraordinary equipment, and we had this 17-year-old child genius there, and you were explaining some of the things that we did. I think you amazed even him. Ventura County Medical Center, do they have the most up-to-date equipment? What kinds of things do you have to help you in your practice?
Well, yes, they do. And I think that the nice thing about the medical center is that they've worked towards developing that and getting the appropriate equipment that we need. And couple of the things that have recently been installed or begun to be used over there, one is something called the Pac System. And the PACS is availability of having radiographs that can be online, meaning that in the past when a film was taken, the film was shot and then a hard copy was made. The problem with that is that there was essentially only one copy that would then stay in the radiology department. To get information regarding that, you would either have to come in yourself to see the film, or you'd have to call the radiologist to get that information. As a neurosurgeon, the problem with that system has always been that we plan for surgery, or if we're looking to do an operation or concerned about having to do an operation, we really have to see those films. We take the support of the radiologist and get their input, but if we're considering an operation or trying to plan something out, we need to see those films ourselves. What PACS has done is it is, again, an online ability to see the radiographs. So for us, what that means is if a patient comes into the emergency room and I'm called about a patient who has had a head trauma or a possible bleed inside the brain or a spinal fracture, instead of talking to somebody about what the film shows, if it's after hours and I'm home or late in the evening, I can go to my computer, pull that image up, and what happens is that I can immediately get a feel for what's going on with that patient. If it was an emergency or something that needed to go to surgery right away, I have the ability to make that decision over the phone, and then while I'm heading in, the OR and the ER, all of that can be moving towards doing surgery. And again, in the past, it usually requires a neurosurgeon or somebody to come in, take the time to look at the film, and then make that decision. But that's one of the nice things that we've developed. And it's really been in use probably over the last almost a year now, and I think it's made a big difference, patient care.
Well, you've described really quite a team. I mean, you're one member of the team, and here you can be available at home, see everything that you're going to see in the hospital, be able to look directly at a person's brain after they've been in a trauma. Do we have some kind of trauma team? Ventura County Medical Center has, I know, the house staff, but who are the other members of the team? You really described a bunch of people coming together.
Well, it is, and I think that if looking at what is done at the Ventura County Medical Center, I think what makes it an excellent team as far as trauma care and the evaluation of patients is it isn't just the emergency room doctor. It is the emergency room physician. Usually there's 2 physicians on staff. There are residents that are there, usually more than 2. And so that if an acute trauma or somebody in life-threatening condition comes to the ER, what happens is those ER physicians are there, the residents are there to evaluate the patient. There's a trauma attending who is usually a general surgeon, and they are within what they call a rapid response so that they can come in and oversee. Several of them are critical care boarded so that they can do both the assessment as a trauma surgeon, but also as a critical care physician. The other person that plays an important role is the ICU attending. In the ICU, there's always an attending that's on every week, overseeing the ICU patients, and there's ICU residents. And usually, so if a trauma comes in, what you have is you have a series of physicians all looking at that patient immediately. And you'll have an attending ICU staff, you'll have an ER physician, and usually a trauma surgeon there to evaluate. And then the other specialties are there. Myself in neurosurgery, plastic surgery, ear, nose, and throat, orthopedics, and those services are immediately available. So that makes it nice for me, because I know if somebody comes in with a multiple trauma and a broken hip and a chest wound and some other abdominal injury, I know I've got the team there. So that's nice.
So you can concentrate on the head and the spine, and the chest surgeon goes for the chest, and the general surgeon for the abdomen.
Right.
Wow. Well, of course, that's just Monday through Friday, I'm sure, 8 to 5.
Yeah, no, it comes in anytime. I mean, you really know that when we're on, and it always rotates, but when we're on. You know, usually it's 24 hours a day, and so we're always available.
So, but it must take several hours to get all these people in one place.
As far as you mean getting to the emergency room?
Well, no, just say once they hit the emergency room, they've got to find you, and you're off somewhere else, and the surgeon's somewhere else. So it must take several hours to get everything ready.
No, actually, it's pretty immediate. In fact, it's very immediate. In the middle of the day, we're all close at hand. I don't think any of us have an office that's not within 5 or less 3-minute walking distance to get to the emergency room, so that's nice. In the evening, all of us live close. You know, there definitely is a feel of all the physicians involved of this responsibility to be close. And that includes, I should say, the anesthesiologist. They are all readily available, and that makes it nice.
Well, how fortunate for us in Ventura County to have that kind of team available. And of course, we want you to walk down and cross the street and not get hit yourself.
Right.
That would be
look both ways.
And look both ways, and we want to practice good safety. But we know that the tools that you have are really not just for trauma. It's nice that we can bring those kinds of tools in that help you during trauma. But as a neurosurgeon, we really are trying to get our kids on long careers here. To be a neurosurgeon, how many years of school does it take? What kind of schooling does it take?
Well, it is one of the longest training programs. You know, getting through high school, college is another 4 years, and during that, you really do have to be the top of your class, because the next step is medical school. And then in medical school, that's usually where you get the feel of, is this what you really want to go into? So that's another 4 years. So you have 4 years college, 4 years of medical school, and then most neurosurgery residency programs are 7 years now. Some are actually going to 8. So by the time you're done, you're somewhere in your 30s before you're really ready to go out and work in the field of medicine or neurosurgery.